Halton Healthcare Services runs 3 hospitals. So we run the Georgetown Hospital, the Milton Hospital, and the Oakville Hospital. And all 3 of our communities are growing, and all 3 of them have fairly dated facilities that need to be rejuvenated and brought up. So at the Georgetown Hospital, we have just completed the building of a brand new emergency room. We're installing a CT scanner over the next couple of months and then making some internal changes. So a wonderful new emerge environment and all the supporting technology that they need at the Georgetown Hospital to serve the community in that emergency department. If you haven't driven down in Oakville recently, it's kind of hard to miss it, but we're building a brand new hospital in Oakville. It's the new Oakville Hospital. It's on Highway 5 near 3rd Line. And it's a big building. It's about 1,600,000 square feet. It's a complete replacement. So the old OTMH will be shut down, and lock, stock, and barrel, we're moving up to the new Oakville Hospital. So a big project, and that hospital should be opening in around December 2015. So we're just under 2 years away from, or around 2 years and a bit away from opening it. And then of course Milton. So Milton is the fastest growing community in Canada. I think everybody knows that now. We've been certainly telling lots of people that as we make the case for Milton. The hospital there was built for a community of 35,000 people. There are now over 100,000 people living in Milton, and we're clearly undersized, so we really feel the pressure. Emergency, obstetrics, our inpatient beds, our ORs, we just don't have enough room for the new Milton. So we're working on that. So we have a approval to proceed with an expansion of the Milton Hospital, and we can talk a bit more about that. I think the big thing for us though, besides being bigger, and it will be 3 times as big as the existing hospital, that's the expansion that we're adding, it's also going to be a different kind of environment. So the old Milton Hospital is very reflective of the sort of 1950s, 60s way that people thought about hospitals. So very efficient and very easy to clean and those kinds of things, but not very warm, not very home-like, and tough for patients, tough for family, tough for staff. So we really do want to create a holistic environment that cares about, the environment that we build needs to care about the people as much as it cares about the nurses and the doctors and the things that we're doing in the building. So it's a great opportunity to both get bigger, but also to get better.
Okay,
yeah.
So let's talk specifically about some of the areas that you are expanding in the Milton Hospital.
Sure. So the big area, obstetrics, is going into the new wing and will be significantly larger, along with its own operating room area, so that we have a completely dedicated OR for moms. Brand new medical surgical, inpatient units, brand new intensive care unit, brand new ORs. We're going from 3 ORs up to, there's different equivalents, but almost 7 rooms now that we can be doing different surgeries in. There'll be a brand new emergency department and brand new diagnostic imaging department, and the big news, we're adding in the diagnostic imaging department, there will be an MR added. So besides the CT scanner that we just put in the Milton Hospital about 3 years ago, we'll now have a magnetic resonance imaging machine, which is it's a very important tool as well for diagnostic work in the hospital. So lots and lots of changes and lots of expansion happening. Yep.
Okay, so I guess the big question is, when can Milton residents expect to see this happen? What's the timeline? Maybe you can take us through the
Sure.
process of where things go from here, because the process is well underway, isn't it?
Yeah, well, we've been working away this. It's one of those projects that designing hospitals, there's tons of work that has to be done before you put a shovel in the ground to make sure that you've properly designed and thought about and built in what needs to be in the hospital. So we've bought some land. We bought an additional 8 acres of land. So we now have close to 38, almost 40 acres of land for development on the property. And we've been working with the Ministry of Health on getting agreements on what services and how much of each service will go in the expanded building. And that's what we've been working at primarily. We've also gone to market, so we've issued a request for qualification. So we are, when it comes time to build, we'll be bringing in private firms they're going to form a consortia, and we are looking for the design architect and the general contractor, a financing body. They have to bring a financing arm with them to finance during construction and then to finance for 30 years after we take ownership. And then another company that will maintain the physical plant for 30 years after we take over. So that's what we are going to market for that. So right now we have a request for qualifications out. This goes out globally, so we will be looking for consortia coming from all around the world to work on the expansion of the Milton Hospital. We will narrow that down to three consortia. So we'll be issuing the request for proposals in late March 2014, and then we'll be working with the three consortia, the three groups of firms, for about 6 months to make sure that they have a bid that's fully meeting our expectations and needs. So the request for proposal period closes in September of 2014, and then about a year later, so maybe early 2015, we should have a financial close agreement, and then construction will be starting shortly after that. So right now our key date is coming to an agreement on an understanding of what consortia will do the work in early 2015, and then that firm will have to say what is the construction schedule. But we would expect spring of 2015 to see construction starting.
Okay. And that's when we'll sort of have an idea of what the new hospital is actually going to look like.
Yes,
because we don't know at this point, do we?
That's right. Yeah, well, we have some images, and I think maybe we can begin to start to share some of those images. But until the design architects are on, there will be changes. So it's, yeah, we're being pretty careful not to get early images out, because there will be continuing adaptation to them.
Absolutely, absolutely. Well, how important is community support in making these big capital projects happen?
Sure. Well, we could not do this project if we didn't have community support. The Ministry of Health, the Government of Ontario, finances 90% of the bricks and mortar and the planning and design work. So they cover about 90% of that. 10% then has to come from the local community. So we have to raise that locally. The big issue, though, is that all of the clinical equipment, all of the equipment the doctors and nurses use to diagnose people, to treat people, to help people while they're in the hospital, all of that has to be funded locally. So 100% of the equipment going into the hospital that's used for patients has to come from the community. So we could not on our own equip the hospital. We don't have any kind of resource capacity for that. The ministry doesn't fund it. So the work the foundation is doing is critical to having the right equipment in the hands of the right people. So when people from Milton come in and expect to find diagnostic equipment, x-rays, ultrasounds, all the things, and operating rooms and all the equipment that goes into them, and if you're admitted, think about all the pieces of equipment that have to be in an inpatient room to care for somebody. All of that has to be fundraised for. So Foundation is doing a great job. They're a critical piece of this puzzle coming together for the hospital. And the Foundation is totally dependent on residents and citizens and businesses in Milton. Without the support of those people, and the very generous people that live and work in Milton, we couldn't make this happen. The staff at the hospital, the doctors and nurses and all the other professionals that work there are incredibly excited about this. I mean, they have been providing unbelievably good care to the residents of Milton and others who are coming to that hospital for service. They've been doing a great job in a very difficult environment, because we really are undersized and we have a very dated building. So full kudos to the staff, and I know they put so much into it because of the very positive support and feedback they get from the residents of Milton. I mean, I hear nothing but compliments from people on the street in Milton about the care they get at the hospital, and the staff hear that and they appreciate that, and it makes them want to give back more. So they are super excited about the hospital. There's a family campaign going on. They're giving as well. To this project, and they know that unless the community gets behind them and helps with the equipment and helps through the foundation to make gifts so that we can get the right equipment for them, they can't do their job. So they're excited, and they're really hoping that the town will be there for them to help get the equipment that they need.